it's a remarkable facility, and I want to thank Steve. I want to thank the Smith Family Foundation for making this happen. It was their vision. They found the right partners with Daymark and Alliance, and because of their vision, their ability to get people around the table, folks in Mecklenburg County have services. When a person out there is experiencing a behavioral health crisis, they need to have somewhere to go right then. It's not enough to say, why don't you come back at 9 a.m. tomorrow morning? That's not how it works with behavioral health. You need to be open and ready to receive them. And these folks are 24/7, open doors. Whatever your issue is, you can come here. You get assessed. You get assessed physically. You get assessed mentally. And whatever service you need, it may be detox if you have addiction. It may be you have a physical ailment. They will connect you to the right partner out there in the community that can serve them. We have a lot that we need to do on mental health care in North Carolina. One thing we have to do is reduce stigma, and that's one thing that Steve is doing and a tremendous job of letting people know that if you have some issue, deal with it. You don't have to put it down and stuff it away. Confront it, face it, overcome it, and you can be happier, you'll be healthier, you'll be living a much more fulfilling life. The state, unfortunately, this year, it has cut a number of mental health programs, tens of millions of dollars. So the first thing the state needs to do is to restore the programs that they've already cut. The second thing they need to do is expand or to fund Medicaid. Medicaid is the number one source of payment for the services that are provided here, and this legislature refuses to fully fund Medicaid. Both sides agree, the House and the Senate, that the state does not have enough money to operate Medicaid, but they refuse to come together. They're allowing unrelated political disputes between the two chambers to get in their way of funding Medicaid to ensure that providers like this all across North Carolina get fairly compensated for the critical work that they provide to the 3 million North Carolinians who are on Medicaid. So I call on the General Assembly, put your political disputes to the side, do what you know is right for the people of North Carolina, and fully fund Medicaid. Steve, any comments you'd like to offer on the work you're doing here?
The work we're doing here is one, I'm not alone. I have the opportunity to work with Daymark and just all the folks at the Steve Smith Family Foundation. They do a remarkable job. And having the governor here and just kind of seeing the facility, see what we're actually doing, why we're doing it, how we're impacting, and knowing the people that are around are actually doing the work. They're just not receiving checks. They're not just complaining. They're talking and doing the work. And the hands and feet that are actually hitting the pavement, working in this community. And so it's remarkable, and I am thankful and proud for my staff to be able to see and be recognized of what they've been doing for the last couple of years and how much of all the work they've done behind the scenes that they're finally getting the credit that is due in mental health.
Thank you. Happy to take any questions. Let's concentrate on the topic of the day before we open it up to some other questions. Yes, sir.
If Steve can talk about just, you played the game as hard as you did, and the governor spoke about that stigma that can be surrounding mental health. We just lost Marshawn Nealon a couple weeks ago. If you could address what it's like seeing that veil come down on the stigma of mental health, especially among men.
Well, I don't think the veil is. I don't think the veil is actually coming down. I think what we're doing is we're making a conscious effort to bring attention to it, and then as we bring attention to it, people can't continue to avoid it. COVID was a great example, and it had great numbers and data information to know that we had a serious problem in the mental health field, but when COVID hit, it was unhideable. It was very evident that there was a lot of things happening behind closed doors. When COVID hit, everybody's doors was closed, but the issues never went away. And so that's how we got here, and I don't believe that the veil or the thing is the NFL is the NFL. That's a different entity. Mental health is its own entity that needs its own supporters and its own deep-rooted financial support and follow-up. That it's not about who is doing it. It's more about how many people we keep losing because of mental health.
I'll just add one comment on that, if I may, Steve. You know, if you're out there and you've got a rotten tooth and you're in pain, you know it, And if you have the resources, you'll go to a dentist and address it. If you are out there jogging and you trip on a curb and bust your knee, you know it. If you have the resources, you'll go get care. There are folks out there who know that they're dealing with a mental health issue. It may not be as apparent to the rest of the world, but they know they're dealing with it. And what we want and what this facility allows is for this is a place you can come whether or not you have insurance. If you have that need, you know you need it, these folks are wonderful. They have an open door and they will serve you and they will connect you to whatever resources you need to get to a better place. And that's what we want for all the people in North Carolina.
Courtney Davis with Spectrum News. To see the impact that this has already been able to do, I mean, how much do you hope that this inspires other people to open facilities like this across the state to try and make sure that there is that 24-hour care for people when they're going through a mental health crisis?
Well, that's actually a fantastic question, and I'm not really sure. When you just put it in a category of what you can do, I mean, what we're doing is less about who is doing it, and it's more about the people we're serving. And that's really the focal point that I try to make sure is I utilize my name, but I'd like to have people invest in our foundation because of our services, not because of the people they can rub elbows with.
And I'll speak on that as well. I last month visited a BHUC, a Behavioral Health Urgent Care Center in Greenville that was just about to open their doors. The doors are now open today. And there are a number of these sprouting up around the state. This is a great example, serving a lot of people in Mecklenburg County. We need more of these. So the fact that Steve saw a need before it was really out there being talked about is really a testament to his vision and leadership. But we do need many more of these across North Carolina because what we want is for when someone is in crisis to have a place to go where they can get well. If they don't, it's going to be the police or it's going to be the emergency department. Neither of those places are where we want people with mental health crisis to go. Emergency department's incredibly expensive. The criminal justice system, that's not what we want for people. We want to address their underlying issue before it becomes a criminal problem.
All right, we're gonna take a quick switcheroo. Thank you all. We'll come back over there in a second.
Happy to take other questions. Yes.
We are in the middle of the largest immigration operation in the history of the state. Around 200 people have been detained. Yesterday, 21,000 kids didn't go to school out of fear. So why North Carolina? Why the Border Patrol are in North Carolina?
You have to ask the Border Patrol. I don't know why they chose North Carolina. We've not had as fulsome conversation and insight into their policies. Well, why are they here? How long they're going to be here? Where they're going to be? This is all information that we're asking them to try to get more information, and we've not yet received it. Every person deserves to be safe in their community. We want to keep people safe, and if there are violent criminals, if there are drug traffickers who are causing all kinds of damage in our communities, we want them to be held accountable. And that's true if they're a U.S. citizen or if they are here illegally. And if they're here illegally, we want those folks deported. What we're seeing, however, here in Charlotte is folks, federal agents, paramilitary gear, masks on their face, unmarked cars, just driving in parking lots, picking people off of sidewalks, going to stores, going to churches, and grabbing people. And it's because of the color of their skin. That's why these folks are being targeted. That is not how we are supposed to do it in this country. I want the people of Charlotte to follow the law, to be peaceful in whatever they do, and if they see something wrong, to record it and report it to local law enforcement.
What is your message for the Latino community? They have been targeted, and you mentioned also instances of racial profiling. What is your message for Latinos in Charlotte especially?
Our state is a stronger place because of all the people of this state, including the immigrant community. We have all benefited economically, culturally, from everybody in this state. Our state is stronger because of our people. Yes, the fact that people are being targeted because of the color of their skin. You know, there's a story a couple of days ago of an American citizen. He wasn't born in this country, but he's a citizen. He was stopped once, asked for his papers. He went on his way. He got stopped again. Then they bashed in his window and threw him to the ground. He's an American citizen. To ask Americans for their papers, that's not how we do it in this country.
Governor, in addition to continuing to operate in Charlotte, there are now reports that Border Patrol agents are conducting operations in the Raleigh area. Are you aware of any other North Carolina cities or counties where Border Patrol might be headed next? And do you have any updates on how long Border Patrol could be operating in the state?
I don't. These are all questions I encourage you to direct to the Border Patrol. We have heard reports that they're operating in Raleigh and Durham, but how long they're going to be there, how many are there, this is all information we don't know.
And one follow-up question, if I may. Have you spoken with any federal officials from Border Patrol, Homeland Security, the Trump administration about Border Patrol's actions?
We have reached out to the White House and did not hear back. There has been some communication between Homeland Security and my Department of Public Safety, but it's more to inform us that they may be in some place, but there's not a lot more information than that.
We have time for one last question.
Nobody else. Governor, just being here at the B-Hub, what's your message to your constituents who are distressed out about Border Patrol and their actions in the Charlotte area?
Yeah. The people of North Carolina deserve to be safe. They deserve to live not in fear of being swept up. If you are committing crimes, if you have hurt people, we don't want you here and we will deport you. But we just saw some data about what they were doing in Illinois. 97% of the people they detained did not pose a serious public safety risk. 97%. This is not a targeted operation going after a few truly bad people who are hurting folks in the state. They're just sweeping up people, causing fear, stoking division. It is not what we need in this country. What we need is for Congress to pass a comprehensive immigration law. We all deserve secure borders. We deserve to deport anyone who hurts North Carolinians or Americans. But we also deserve to have a pathway to legal status for people who've been here a really long time, who've invested in their community, who are law-abiding, they pay taxes. They do not need to live in fear of this government coming up and sweeping them off the streets.
All right. Thank you, everybody.
Thank you.